All right, so you've heard the general report from around the state, and I think everybody's experienced similar low numbers of cases recently, which obviously is quite welcome. And across the country, that's been the case as well for the most part. So we're a bit in this waiting phase here, and it's unclear how this waiting game will end over the next month or two. And so we have a double feature, but probably only one of these will come true. It either will be this waiting that will result in this kind of farcical and messy catastrophe, as was the movie Waiting, or this somewhat anticlimactic ending as Waiting for Godot, when nothing actually shows up. Sorry if I just gave away the ending of Waiting for Godot for those who haven't seen it. But we'll talk a little bit about what maybe we can expect, and if we do see BA2 surge here in the next month or so in the US, what will happen. So these are the data from genomic sequencing over the last couple of months in the US. You can see that dotted line. It's the 60-day mark. And keep in mind, these data take about 10 days really to populate. So we're still 10 days to 2 weeks in the past when we look at the latest data. But you can see that last band of BA2 now is beyond 50% even 10 days ago. And so BA2 has now taken over as the predominant strain in the US, as we've discussed, and that has clearly continued and at a pace that's now relatively similar to what we had seen with Delta takeover and Omicron takeover. It took a little longer to get to that point. You can see the inflection point took quite a bit longer, but once it started taking off, it grew relatively rapidly. So the question is, are we going to see a large BA2 spike like we have in other countries, or are we going to somehow dodge the bullet and again, nothing will show up? So a couple of points to keep in mind about what to expect if we do see a large BA2 spike. So I think we've discussed South Korea a number of times in the past as an example of a country that has done quite well in maintaining suppression of COVID transmission over the course of time, but has had a large BA2 spike. And you can see that relative to its previous COVID waves, where they don't even register on the per capita scale now because of BA2, they've had a huge explosion of cases in South Korea over the last month or so, much higher in terms of official case counts per capita than we had in the US. Now, I would argue that South Korea does a better job of counting. They test more aggressively. So those two curves are probably relatively similar in terms of actual number of cases per day per capita. But you can see, again, where we had large epidemic waves periodically over the course of the pandemic, due to the fact that we did not implement targeted NPIs the way South Korea did. We had a much larger Omicron wave as well, but theirs looks quite different, as again, almost minimal activity on a relative scale until the Omicron wave. Now, if you look at their vaccination and boosting rate, that's a different story. So again, South Korea's strategy has been one of maintaining aggressive non-pharmaceutical interventions, although not terribly disruptive, to be honest. They were not in lockdowns. They didn't shut down a lot of business activity, but they were quite intelligent and very deliberate in the way that they implemented their non-pharmaceutical interventions. And then once they were able to get their hands on vaccine, which was quite a bit later than the US, they initiated an aggressive vaccination campaign, and in fact have continued with an aggressive campaign of boosting. And so you can see that over 60% of the population of South Korea has received a booster. Those numbers are a little bit difficult to interpret because some South Koreans have actually received 2 boosters now, and so it may be a bit lower than what appears to be the case here. But as you can see in the US, we're still below 30% of the population receiving a booster. So what I mentioned before, the complicating factor is that in late February, South Korea actually started administering second booster doses or fourth doses of mRNA vaccine to high-risk citizens. And so some of their elderly have actually received 4, but just indicates the fact that it's a highly boosted country. So most of the population is up to date on their vaccine, which means that they've had 3 doses of mRNA. And a portion of the highest risk have had 4. So if you go back and look at that cumulative case count, you can see that over the course of the pandemic, South Korea is now just caught up with us in terms of the number of confirmed cases of COVID-19 in the population. Again, they, I think, are a little better at case ascertainment than we are. So in reality, we're still probably higher in terms of the number of people who've been infected overall in the population. But the point is that they've made a huge dent in the gap and almost eliminated that gap just over the last month with Omicron. The big difference, however, is in mortality. And you can see that while we continued to accumulate large number of deaths over the course of the pandemic up until recently, South Korea did not. They had just a very, very slow increase that accelerated a little bit when Delta came about this past fall, and then has ticked up again with Omicron. But if you look, even though they've caught up with us essentially in cases, they are nowhere near where we are in terms of deaths. And even if we have very little in the way of BA2 and subsequent Omicron deaths that continue to accumulate, which is a stretch, I think we still will, even if we don't have a BA2 wave. South Korea will probably cap out around 500 or lower in terms of deaths per million people from COVID-19, whereas we are above 3,000. So you can see that they are still many, many, many times lower in terms of the impact. And again, that's the effect of very good suppression with non-pharmaceutical interventions up to the point of vaccine, and then widespread vaccination campaign and boosting once you get vaccine availability. And that was always kind of the plan for pandemic management in the US when these plans were drawn up in the 2000s. Unfortunately, we just didn't execute the plan the way that we thought we would. Another example of a country that is somewhat in between the US and South Korea, not nearly as good in terms of their non-pharmaceutical intervention management, however, very good in terms of implementing widespread vaccination campaigns and getting boosting rates up higher. That's the UK. And as you can see, the UK is, we've discussed, has had a pretty large surge from BA2 just in the last month or so. And that's that double humped wave of Omicron, BA1, and then BA2. They may have rounded a corner and started to peak and decline, but we'll see. But from a boosting perspective, the UK looks a lot more like South Korea than does the US. And so the low numbers of hospitalizations relative to cases in the UK may not be something that we replicate here in the US. So this is the UK's case curve compared to the US. And you can see we've been pretty similar in terms of the number of cases per day per million. Over the course of the recent epidemic waves, including Omicron, but where we have continued to decline here, the UK had a more rapid overtaking of BA2, becoming the predominant strain, and had this BA2 wave now that they seem to have potentially peaked with. We are at a low level now, but with BA2 proportion rising above 50% now across the country. And so remains to be seen whether we are going to see another spike. But if we do, I don't think we're going to see the low number of deaths per million that the UK has been able to experience. So you can see that in the early epidemic waves. The UK had higher per capita deaths from COVID in their epidemic waves than the US did. However, after the beginning of, after the spring of 2021, when vaccines became widely available, the UK did a better job of vaccinating their highest risk folks and then subsequently boosting once boosters became part of the mix. And so you can see since this past summer, they've had a dramatically lower rate of fatalities from COVID-19 than we have through the Delta waves and Omicron waves. And their Omicron BA2 wave is causing a bit of an upswing in deaths, but again, nowhere near the magnitude of what we've seen in our previous waves. And I don't think that we're going to be as lucky again because of our lack of boosting. So that leaves us with what's going to happen with BA2 in the US right now, and what can we look forward to or not. And right now it's a bit of a toss-up, to be honest, even less clear than where we were a week ago, where I thought data were clearly indicating that we were back on the rise and we were going to see a significant upswing in cases. We are seeing that trend across probably about a third of the states, mostly in the eastern part of the US, where case counts are on the rise, but they haven't hit a dramatic inflection point yet. And the wastewater, oh, gracious. I thought I had the wastewater data in here as well. The wastewater data are kind of equivocal over the last week. You remember from last week, we started to see an upswing in wastewater from previous weeks in February, where it looked as if, particularly in the Northeast, there was kind of a turning point, and SARS-CoV-2 concentrations in wastewaters were going back up. They've kind of leveled off. So they've gone up a bit and then they've kind of plateaued. And so it's unclear where that's going to go from here. But at least right now, it doesn't look like we're on the dramatic upswing of an upcoming wave. We may be in the slow building phase that leads into that. Nevertheless, just to step back and take a toll on the mild virus Omicron that we've just experienced, I think, again, important to keep in mind the impact that it's already had, and again, much of it reflecting the low rate of boosting that we have in higher risk populations. Since the beginning of December, the US has experienced over 200,000 deaths from COVID-19. Since January 1st, when really just about everything was Omicron at that point, almost 160,000 deaths. And just since the beginning of February, almost 100,000 deaths. So hardly mild, as we've discussed, and we'll wait and see what happens with BA2. Thanks.